What is inflammation? What's inflammation?
I know this is a corny joke.
No, it's not. What is inflammation? This is for my project.
According to our OpenStax Microbiology book online, the inflammatory response, or inflammation, is triggered by a cascade of chemical mediators in cellular responses that may occur when cells are damaged and stressed, or when pathogens successfully breach the physical barriers of the innate immune system. Physical barriers of the innate immune system include skin, hair, cilia, mucous membranes, mucus and chemical secretions, digestive enzymes in the mouth, and stomach acid. An early, if not immediate, response to tissue injury is acute inflammation. Immediately following an injury, vasoconstriction of blood vessels will occur to minimize blood loss. The amount of vasoconstriction is related to the amount of vascular injury, but it's usually brief. Vasoconstriction is followed by vasodilation and increased vascular permeability as a direct result of the release of histamine from resident mast cells. Increased blood flow and vascular permeability can dilute toxins and bacterial products at the site of injury or infection.
The 5 observable signs associated with the inflammatory response are...
Hurt so good. Come on, baby, make it hurt so good. Sometimes love don't feel like it should, baby. Hurt so good.
Vasodilation and increased vascular permeability are also associated with an influx of phagocytes at the site of injury or infection. This can enhance the inflammatory response because phagocytes may release pro-inflammatory chemicals when they're activated by cellular distress signals released from damaged cells by PAMPs. Or by opsonins on the surface of pathogens. During the period of inflammation, the release of bradykinin causes capillaries to remain dilated, flooding tissues with fluids and leading to edema. Increasing numbers of neutrophils are recruited to the area to fight pathogens. As the fight rages on, pus forms from the accumulation of neutrophils, dead cells, tissue fluids, and lymph. Typically, after a few days, macrophages will help clear out this pus, and eventually tissue repair can begin in the wounded area.
We got the chronic. We got the chronic.
When acute inflammation is unable to clear an infectious pathogen, chronic inflammation may occur. This often results in an ongoing and sometimes futile lower-level battle between the host organism and the pathogen. Chronic inflammation may lead to the formation of granulomas, pockets of infected tissue walled off and surrounded by white blood cells. Macrophages and other phagocytes wage an unsuccessful battle to eliminate the pathogens and dead cellular materials within a granuloma. Chronic inflammation is not just associated with bacterial infections. Chronic inflammation can be an important cause of tissue damage from viral infections as well. The excessive scarring observed with hepatitis C infections and liver cirrhosis is the result.
Hey guys, I hope my video wasn't an information overload, but I hope you enjoyed it, learned a bunch of stuff, and good luck!